Welcome to our video on Top 10 Studies on the Relationship Between Heat Waves and Health Risks. As global temperatures rise, understanding how extreme heat episodes impact our health becomes increasingly critical. In this video, we will explore key research findings on increased mortality rates, heat-related illnesses, and the particular risks faced by vulnerable populations. We'll delve into the connections between heat waves and various health challenges, from cardiovascular and respiratory issues to mental health effects, while also examining the economic implications and potential adaptation strategies. Join us as we uncover the profound effects of heat waves on human health and the broader implications in the context of climate change. 1. Increased mortality rates. Heat waves are not merely uncomfortable, they can be deadly. Research has consistently shown a link between rising temperatures and increased mortality rates. One pivotal study revealed that for every 1 degree Celsius increase in temperature, the mortality rate could rise by approximately 25%. This statistic is particularly alarming for the elderly and those suffering from chronic health conditions, as they are more susceptible to extreme heat. The human body struggles to regulate its internal temperature during heat waves, and for vulnerable individuals, this can lead to fatal outcomes. The study's findings underscore the importance of understanding and mitigating the health risks associated with heat waves to save lives. 2. Heat-related illnesses. Heat waves bring a significant rise in heat-related illnesses, such as heat exhaustion and heat stroke. The body's cooling mechanisms can fail during extreme heat, leading to these dangerous conditions. A study conducted in the U.S. reported a noticeable increase in emergency room visits for heat-related illnesses during heat waves. This surge in medical emergencies places additional strain on healthcare systems, highlighting the need for public awareness and preventive measures. Simple actions like staying hydrated and avoiding outdoor activities during peak heat can help reduce the incidence of these illnesses. Understanding these risks is crucial for public health officials to prepare and protect communities during extreme heat events. 3. Cardiovascular risks. The connection between heat waves and cardiovascular events is another area of concern. High temperatures can exacerbate existing heart conditions, leading to an uptick in heart attacks and hospitalizations. The stress that extreme heat places on the body can trigger cardiovascular issues, especially in those already at risk. Studies show that during heat waves, the heart has to work harder to maintain normal body functions, increasing the likelihood of adverse events. These findings emphasize the importance of monitoring heart health during hot weather, particularly for individuals with known cardiovascular issues. Awareness and preventive care can help mitigate these risks during extreme heat conditions. 4. Respiratory problems. Heat waves can also have detrimental effects on respiratory health. A study found that during heat waves, air quality often worsens due to increased ozone levels. This deterioration in air quality can lead to respiratory issues, such as asthma attacks and exacerbation of other lung diseases. Vulnerable populations, including children and the elderly, are particularly at risk. The combination of high temperatures and poor air quality creates a hazardous environment for those with pre-existing respiratory conditions. These findings are crucial for public health planning, as they highlight the need for strategies to protect air quality and vulnerable populations during heat events. 5. Mental health effects. Beyond physical health, heat waves can also impact mental well-being. Prolonged exposure to high temperatures has been associated with increased rates of mental health issues, including anxiety and depression. The stress of coping with extreme heat can exacerbate existing mental health conditions and lead to higher incidence of violence and aggression. Research suggests that the discomfort and sleep disturbances caused by heat waves can further contribute to these mental health challenges. Recognizing the mental health implications of heat waves is important for developing comprehensive public health responses that address both physical and mental health needs during extreme weather events. 6. Vulnerable populations. Certain groups are more susceptible to the health impacts of heat waves. The elderly, infants, and individuals with pre-existing health conditions are at greater risk of suffering from heat-related illnesses. Studies emphasize the need for targeted interventions to protect these vulnerable populations. Community programs that provide access to cooling centers and regular health check-ins can significantly reduce heat-related risks. Public health messaging tailored to these groups can also improve awareness and preparedness. Understanding which populations are most at risk allows for more effective resource allocation and protection strategies during heat waves. 7. Urban heat islands. Urban areas often experience higher temperatures than their rural counterparts, a phenomenon known as the urban heat island effect. This effect exacerbates heat-related health risks for city residents during heat waves. The abundance of concrete and asphalt in cities absorbs and retains heat, leading to higher temperatures. Studies show that this can increase the incidence of heat-related illnesses and mortality in urban populations. Urban planning measures, such as planting trees and creating green spaces, can help mitigate this effect. These strategies not only reduce temperatures but also improve overall urban living conditions, highlighting the need for thoughtful urban development in the face of climate change. 8. Economic impact. The economic impact of heat waves is significant and multifaceted. Studies estimate substantial costs associated with healthcare expenses, lost productivity, and increased mortality during heat waves. The financial burden on individuals and healthcare systems can be overwhelming, highlighting the need for effective mitigation strategies. Businesses may experience reduced productivity as employees struggle with heat-related discomfort and illnesses. Additionally, the increased demand for healthcare services during heat waves can strain resources and lead to higher costs. Understanding these economic implications is vital for policymakers to develop cost-effective strategies that protect both public health and economic stability. 9. Adaptation strategies. Research highlights the importance of developing adaptation strategies to combat the effects of heat waves. Increasing access to cooling centers, improving public health messaging, and implementing urban planning measures are all crucial steps in reducing heat exposure. Education campaigns can help the public understand how to protect themselves during extreme heat events. Urban planning strategies, such as increasing green spaces and reflective surfaces, can help mitigate the urban heat island effect. These adaptation measures are essential for building resilient communities capable of withstanding the challenges posed by rising temperatures. 10. Climate change connection. Many studies draw a direct line between the increasing frequency and intensity of heat waves and climate change. As global temperatures rise, projections indicate that heat waves will become more frequent and severe. This poses significant challenges for public health systems worldwide. The link between climate change and heat waves underscores the urgency of addressing climate change at both local and global levels. Proactive measures to reduce greenhouse gas emissions and mitigate climate change can help lessen the future impact of heat waves. Understanding this connection is critical for developing long-term strategies that protect public health in a changing climate.